It feels so good and easy to breathe.
Yes, well, I find it really, really fascinating.
It's not really taught that much in school, but we know how important nutrition is. The tongue is just as important. Did I make the full circle? I hope I'm really trying.
Yeah. Hello and welcome to another episode of Root to Rise. My name is Dr. Emily Spickle, your host. Very excited for today's show and our guest. I actually had her on an IG Live about a month or so ago. Fascinating conversation, and then we followed that with a webinar. This is my very good friend, Dr. Mandeep Johal. So our guest, Dr. Mandeep Johal, she is a biological dentist based out of Ontario, Canada, and she believes in whole body wellness, and it starts in your mouth. She takes an integrative approach to dentistry, showing how oral health connects to breathing, facial and airway development, nutrition, posture, and even the nervous system. With extensive training in areas like airway-focused orthodontics, tongue-tied treatments, sleep apnea, and dental posture connections, Dr. Johal is at the forefront of redefining what it means to care for oral health. In this episode, we will explore how breathing patterns, oral posture can affect the nervous system and the surprising link between nutrition, sleep, stability, feet, and real-world transformations across all ages. Dr. Mandeep, thank you so much for being a guest on Root to Rise.
Thank you so much for having me on, Emily. This is so fun. We could talk for hours. I mean, with everything you said, I'm like, is there even enough time? There's no way we can cover all that.
I know. So consider this the first time coming on the podcast. You'll be back.
Oh my God, we got so much to talk about. So where would you want to get started? There's so much to talk about.
I know. So I would say for the listeners who have not heard the IG Live or the webinar, and they're probably thinking, feet podiatry, how does this connect to the airway? So if you could just start by introducing a little bit about airway mechanics and why it's so important and how our posture connects to that.
Okay, so the basics I'm going to start with, everybody will understand, is nasal breathing and mouth breathing. So what ends up happening, unfortunately, majority of us are unfortunately mouth breathing. And if you're thinking I'm not, majority of us are go, 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 go. If you're always on the go and you haven't really stopped and slowed down and checked on your breath, chances are you're most likely mouth breathing. And that alone, what ends up happening when you're mouth breathing is your tongue sits low. And we talk about mechanics, we're going to keep it real simple, is that when your tongue sits low and your mouth breathe, guess what your head does? It goes forward. Okay, so when your head goes forward, now you're creating that cascade effect happening. Patients are going to be like, my traps are tight. Oh, my mid-back's starting to hurt. And then I had a patient today saying, oh yeah, I'm working with PT on my pelvic floor today. Tongue was tied. We'll talk about it in a different podcast, meaning tongue is sitting down low, mouth is open, lips are chapped. Perfectly functioning nose from what I can see. I'm not an ENT, I'm a functional dentist, but I know he had the capability of breathing through his nose if he needed to. But his low back is killing him and he's working on pelvic floor therapy. And I'm like, we need to work on your breathing. He's like, what does a dentist care about how I breathe? And I'm like, if you can't breathe properly, you are in a sympathetic state, fight or flight. How do you fix something if you're in a constant fight or flight state? So that's why I want to bring our patients into nasal breathing, bringing you into a more calm parasympathetic state and get that posture upright and get your head back where it should be.
Yeah, absolutely. So from a foot to airway, for those that were not on the webinar specifically, we were introduced, or we connected through how you look at airway health to the feet and then got introduced to my work. But just for the listeners, what is that powerful connection between possibly foot posture and airway posture?
So we could go with a couple examples, but like now think about the head. So for every inch you're forward, you will know the numbers for this. There's an extra amount of weight that's being put on your spine. But what carries us is our feet. So now you have these patients that are mouth breathing, forward head posture, and now our feet are doing brunt of the work because they got to carry this forward head posture. Your center of balance is off. It's going to have a detrimental effect. So when I do orthodontic treatment for my patients, we call it airway orthodontics because I care about how they breathe. I'm focusing on head and neck. I do full postural pictures. Yes, I'm not here to treat and tell a patient their hip is off, their feet alignment is like your feet is flat foot or not. That's not my expertise, but I can suspect and direct them to people like you.
Okay.
And they're always amazed, like, why do you care about my feet? I'm like, I can't change your head and neck position, like your jaw position, especially if you're not working on the rest of your body. And your feet are critical to that. So I've seen changes. My example I gave you is my son. So we worked on getting that lower jaw forward, expanding his airway, getting him to breathe better through his nose, expanding that palate. But we noticed that he's really flat-footed. So he would constantly always go forward and do a head tilt. And then a friend of mine's like, Mandeep, he's really flat-footed. This is what you're going to do. And then it was we needing that stimulation for the feet. And our kids these days are constantly in shoes and socks, and they're not getting that stimulation on the feet, which I learned like this has really helped my child, helped both my children, in actually for a lot of things, not just posture, but like attention and so vestibular, it's your proprioception. It's the brain just cares where it is in relative to gravity. If you could give that feedback from like jaw this position correctly or feedback from the feet, the brain's like, oh, thank you. I just cared about where I was relative to gravity. And the feet allow us. It's like a direct connection. I mean, I know this is your expertise.
Yes, but no,
that's what I learned from you.
Yes, well, I find it really, really fascinating, and I like to share other professionals' perspectives of how they see it, because of course I'm taking a very bird's eye view at the feet, and of course how it influences from the ground up. But how you practice sounds very unique as a airway dentist, airway specialist. How prevalent is that in your industry? Are you the only one who's speaking about feet, or is it becoming more commonplace?
So there is you could Google airway dentist. Okay. I am starting a movement called Heal, and I've started this platform at healforleadership.com where we're trying to gather more practitioners that are like-minded and want to collaborate with other practitioners about the whole body, because we practice in silo, and it's just over the years. I've been practicing for 15 years, and we cannot treat our patients on our own, like cure them. Like, we're not in the business of curing, we're in the business of prevention. So I see a lot of children. I treat 0 to 100, but we should really be in the business of prevention. So there are more and more dentists that are becoming what's called functional dentists into the whole airway, and they're putting all the pieces together. And I just came back from a chiropractic conference. I was presenting to them. So they're noticing that there's a need for this, for a dentist to communicate with chiropractors or other practitioners about how the whole, like, what do I treat and how do we work together? So it's happening.
Okay, good. Is it just a posture story? Meaning, if I'm not breathing the right way and I drop my jaw, my head goes forward, my feet collapse, that's a postural story, right? But are there greater effects to mouth breathing or improper breathing patterns for children, for adults, maybe that extend into health in other ways, cognitive protection, emotional regulation? What's the impact besides just posture?
I love that. So I have 2 boys, and like I said, I see a lot of children as well. And a lot of what's come up is a lot of boys are being mislabeled as ADHD or attention deficit. And a lot of it, I always tell the parents, how does your child sleep? The way they sleep, meaning the way they breathe at nighttime. Think about it. We need that restorative sleep. They are growing exponentially, okay? Boys are busy. I'm not saying girls aren't, okay? But boys are being more mislabeled and misdiagnosed with ADHD. I'm not saying it doesn't exist. I'm just saying that it's that sleep component. So if you don't hit that deep sleep cycle, which happens if you're mouth breathing or a child is bedwetting, they're not getting that deep restorative sleep. Of course they're going to act out. If you and I don't sleep, like we had a bad night, we can get up in the morning, have a cup of coffee. We understand we didn't have good sleep. We know what to do. A child does not know what to do.
Right.
They act out. They don't know. They're feeling tired. Of course, they're gonna have their tantrums and they're gonna act out. So, child's sleep is gonna affect their behavior. And when I mean sleep, we're talking about breathing. Did I make the full circle? I hope I'm really trying.
Yes.
So that sleeping is critical at nighttime. No
Yes.
child should ever snore. We do not want to hear loud breathing or snoring at nighttime. It's
Okay.
cute, but that doesn't mean it's normal.
So let's say you're talking to a parent and they're kind of like, well, I don't know. Do you encourage them that you should do a sleep analysis on your child, or just walk into the room and see if your child is sleeping with their mouth hanging open and you can hear them breathing? Because I feel like some parents may be like, yeah, they're quiet, they're sleeping, they wake up, we're good. We've checked the boxes that they are getting X number of hours of sleep. I am as a mother, very uniquely attuned to sleeping, and I want my daughter to have 10 to 11 hours minimum. She just turned 6. And I assess her sleeping, just every aspect because of just the industry that I'm in. But how do you talk about that with parents?
Well, I tell them my story, which is very emotional because, I mean, all parents wanted the best for their kids. So for me, my kids are 21 months apart. And when I was going around asking, why does my son have crowded teeth? This is what led me into this whole functional medicine. Okay, so I'm going to tell you my why. My son had crowded teeth and went everywhere. But he's like, your son's like 3. Why do you care about crowded teeth? I'm like, well, if his teeth are crowded now at the age of 3, what are they going to look like later? Can't we prevent it? And everybody's like, you're crazy. Just wait till he's 13. So thank God for Google. Back then was Google. And I found a dentist in England, London, England, who was like, yep, we're all about prevention, Mandeep. But he's like, if you're going to come all the way here, he goes, you got 2 kids under 2, you're better off seeing my colleague in California. So I went to this amazing mentor and I just called him first. First thing, you know what he asked me, Emily? He's like, how does your son sleep? And maybe I'm a bad mom, but I was like, he's my oldest. Had a little one in bed with me, so I already had one in a bassinet room with me. So my
Yeah.
oldest was sleeping. I'm like, oh, he's amazing. I shut the door, goes to sleep, wake up in the morning. He's delightful, right? Oldest child. And he's like, no, I need you to go in. And I'm like, my God, he thinks I'm like an absentee mom or something. I'm like working, I got 2 kids under 2. I mean, my husband's all, he's helping out as much as he can too. And I was like, okay, yeah, sure, I'll check him out. Oh my gosh. I felt horrible because going in and seeing my son, not just one night, multiple nights over a span of a few weeks, my son wasn't breathing, Ellie.
Oh my God.
Like, what? And it tears me up because I'm like, I feel like such a bad mom. I'm like, how did I not know this? My son had severe sleep apnea.
Wow.
So but he was such a good kid. I had no idea. And how do I know? When am I taught? My pediatrician never asked me. He's a wonderful pediatrician, but nobody ever asked me, how does your son sleep? I didn't fill in a sleep assessment questionnaire, and he's delightful, right?
Yeah.
And then it went down the rabbit hole. I was like, oh my God, he's pausing on breathing. He sleeps with his head tilted up. So now think about head tilt up if you're sleeping. Now compare that to CPR image. So can you visualize when you do CPR on somebody and visualize a kid sleeping with their head tilted up? They're literally doing CPR on themselves all night long. To me, that is such a sad image. And now my mentor is like, that's what I suspected, Mandeep. He goes, if somebody has crowded teeth, that means they have a small jaw. That means they have a small airway.
Okay.
And I'm like, well, what caused it? He's like, it's this breathing. And for him, it was this large adenoids and large tonsils. Again,
Okay.
no idea. So it was totally obstructing his airway. I'm not pro surgery, but sometimes you need it. So I had to get tonsils and adenoids removed. And
Okay.
the teachers were like, wow, he doesn't nap during the day anymore. I'm like, well, you guys never told me. He's like, well, he's a delight. He just sometimes would snooze. And I'm like, oh, but totally different. Like he just had more energy. I didn't even know he was lacking that energy until we got it done. So
Yeah.
yeah, that was a hard one for me,
So
but that's
eye-opening.
where my journey started.
Yeah. So what about for the listeners who don't have children, or were maybe the child who's now an adult, and they're like, oh, that was probably me as a child and my parent didn't do anything. How would we suspect that outside of a partner maybe saying, you snore, you breathe very loud? So what could that be? I know you mentioned a little bit about like chapped lips, but
Chapped
what
lips,
could
yeah.
that be? And then what are some of the actionable steps that we could take now?
So for an adult, if you're waking up with like dry mouth, or you're waking up and your tongue has like these scallop edges, or you're just not feeling rested, like, you're just like, I just don't feel restful. I need to take a nap during the day. Fogginess, like memory issues that you're having. And a lot of people have like the rings, they have
Yep.
phones, they can record the way you sleep and tell you what your sleep is like, how much
Okay.
deep sleep you're having. I would say do that as much as possible to know what your sleep is like. And then the actions you can take is see an ENT, get a referral for an ENT to see is there any obstructions in your airway, in your nose. See an airway dentist to see how they can help you to help you get breathing through the nose
Okay.
and help you with that tongue posture. The tongue posture is critical. If I see babies as well, and when you look at babies' mouths, when you open them, the tongue is here. It literally makes that sound when they're sleeping
Ah,
or their mouth is closed. But we lose that over time because maybe our palates are high volted or our tongue is not what it's supposed to do, or you got congested or you got allergies, whatever it may be. But our tongue is supposed to be stuck on the roof of the mouth. So it creates a negative pressure, right? Which helps lift everything. And one thing we didn't touch on is think about going back to posture, the tongue, the diaphragm, and the pelvic they're all pumps and they're all connected.
yep.
So getting that tongue on the roof of the mouth is critical. So yeah, see your airway dentist, see how they can help you breathing through the nose and get that tongue doing what it's supposed to do, get it out of the airway on the roof of the mouth and get those lips sealed.
Got it. What is your opinion on breathing strips,
Breathe right
mouth
through it.
tape? So the different hacks that you could do at home to
Yeah.
try to break the habit of mouth breathing and do nasal breathing.
So one test I would have everybody do is called the Cutlow maneuver test, where I'll have them put their fingers right next to their nose, and then I'll have you just pull and breathe through your nose. See how you feel. Okay, and now let go. And now breathe through your nose again. Which was easier? I get nasal collapse. See, I get nasal collapse.
Okay.
So, I mean, I don't breathe that heavy. I've been working really hard, thank God for Buteyko breathing, on slowing down my breathing. But most people, like I said, sympathetic state, breathing really fast, you get nasal collapse. So, yes, I would recommend a breathe right strip, nasal dilators, anything to just really get that feeling. Like it feels so good and easy to breathe. Then, if you do that, then I would say, okay, we can tape to start training the muscles. So I don't really tape over the lips. I like to train around,
Yeah.
tape around the lips. And I use kinesiology tape because kinesiology has like this little give, like tactile feeling. And it's a great messaging for the brain to say, hey, work, keep those lips sealed together.
Yeah, I remember you saying that. So I started using mouth tape since we did
Oh,
our
good.
webinar. And it's made of probably kinesiology tape as well. I just buy it for like, I don't know, $6 for
Yeah.
100 of them on Amazon. But was really fascinating. One, it works and you can breathe through them. So the reason that I never did them before is I was like, I have a similar collapse, like a nasal collapse on my left side. I was like, if I do mouth tape, it might trigger like a claustrophobic effect, right? Where I'm like,
100%.
I can't breathe. But there's something about the mouth tape because you can still breathe through kinesiology tape. But it was fascinating that last night I went to the bathroom, whatever, it was like 3 a.m. or something, and then I had to get a drink of water. It's thirsty, so it's like, I'm gonna drink my water. So I lift like a corner of the tape, drink the water, but I did it in like a messy way and the tape got all messed up. So I just took it off and I was like, I'm fine, I'm gonna go back to bed. And I could not go back to bed because it's such an anchor to make me sleep now. I'm very into anchors for sleep. I use weighted blankets, weighted eye masks. I'm very into it. So I just thought it was another fascinating thing that I was like, when I put on the mouth tape, my brain knows it is time to sleep. So, use that for what it is.
I love that. That is so great. I hate creating dependence too. Don't get me wrong. I'm not like, I love that is working for you, but I do hate comparing, like making that dependence as well. Because I know a lot of what's called myofunctional therapists. They are coaches that help train the tongue, train the muscles of the face. They want to help you long term how to get that seal on its own. It's just really challenging to do as an adult. That's what we love treating children. They're much easier to wire.
Got it.
But I just think if you got to use it, just use it, right? So I'm glad that you're using it for you. Yeah, I absolutely love it too.
Yeah, no. So I am curious for the listeners, because I know they are going to be super curious as well, is tongue ties. And you mentioned a little bit in the beginning, and we know that's one of your specialties, but the effect of a tongue tie for a newborn baby makes sense with the latch and a difficulty creating a latch for breastfeeding. But how does that translate all the way into the effect of an adult?
Wow, we definitely don't have enough time to dive into all of it. Let's see. Very quick. So I had an adult patient today, whose case I'm definitely going to document, tied to the tip. She is in her late 30s, tied to the tip. Lived her whole life, no problem, until. But then when she started talking about her health history, lower back pain, trite tap, really, really tight traps, was a dancer, did yoga for years, never, always felt inflexible. Like she just couldn't really touch her toes and she always felt stiff. And her chiropractor said, you know what, you're really tongue-tied. Maybe you should get that assessed. And today we did her release. And as soon as we did the release, her range of motion from mid-back and this just completely changed. Her range of motion, like to look over her traps, changed like instantly with the tongue tie release. She was able to touch her toes. It's not about touching your toes. It's the ease of how you could touch your toes. And that comes down to the deep front line chain, the fascia. Okay. Right? So we have to understand, I was working with the physical therapist who said, Mandeep, your deep front line starts here and ends at your feet. And I said, you're right. It is connected to the feet, but it actually starts at the tip of your tongue. The fascia encases the tongue all the way down to the toes. And so it's that misconception that a lot of people have is our tongue, you swallow 2,000 to 3,000 times a day. Okay? So if you swallowed like this, 2,000 to 3,000 times a day, try it. It strains your jaw, strains your neck, right? So if you're doing incorrect swallow or your tongue isn't functioning the way it's supposed to do, it's going to recruit other muscles to do the work that the tongue isn't able to do. Okay. So now think about, even when you, with yourself, when you treat patients, remember our body can't compensate as well once it passes 35, 40. Our body's like, hey, I'm done. I carried you this far. I'm not working that hard anymore. And that's when things start to deteriorate and we all seek out, oh, we got to do this. I got to do something. I got to stretch more. It's just, it starts from birth. That's why I love to treat babies, obviously, is because it's much easier. The results are great. But adults, it's just our compensation patterns. So the tongue isn't just for swallowing and speaking. There is like a neural connection to our brain, a direct connection to our brain. Think about, again, the nervous system, getting that tongue on the roof of the mouth and triggering that vagus nerve, right?
Yeah, so why do you think tongue ties are not caught or identified as frequently in adults? Are they just not mentioned, or are they seemingly thought to not have an effect after being a baby?
It's research, right? So our industry and medicine in general is like, where's the research? But people forget before research comes clinical studies, right? You observe something in clinic, and then it takes time. It's 20 to 30 years. Like, I think a lot of our society is like, we're so fast paced, we want stuff now. It takes 20 to 30 years. So 20 to 30 years from now, yes, people are going to be like, wow, this is huge. But because this is still the early stages, there is research. My mentor, who's absolutely fantastic, Dr. Shirusagi, I've learned so much from him. Him and his team are doing so much research for adults, and they have published quite a bit. So it's just not that well known and well accepted because it's not really taught in medical school or dental school. It's only taught for, I don't even think it was taught to us in dental school, really, to be honest. Oh, this is the tongue tie, and we moved on. But it's not really taught in med school and dental school. Like a lot of things. Feet are just as important. How much attention is given to feet? Or nutrition. Think about this whole kick-in about nutrition right now that's happening. But it's not really taught that much in school, but we know how important nutrition is. The tongue is just as important. So there will be a time that it's going to take some time. It's going to come around. But it's just because it's just not well documented. And you know what? I can make the argument too, Emily. Like we have some practitioners that don't even believe tongue ties exist for babies. So we still are, it's 2025, and we're still making these arguments for that. So how are we going to progress to adults if they feel like tongue ties don't exist for babies?
Yeah.
And I'm not saying everybody's tongue-tied. Please base it on symptoms. Treat the body as a whole. Look, treat, and listen to your patients is what I would say. It's really important that we hear our patients out. Take our time.
So is a lip tie the same or similar effect, or does that not exist?
So it's different. Like when we're using, what are we using our lip for? So when you're swallowing, it's not really involved as much.
Okay.
I do lip tie releases for different reasons. I'll do it for young children if they're hygiene, like if their teeth, if a parent can brush their child's teeth.
Okay.
And there's like a web, like there's a tie right underneath here. And when the patient goes in or the parent goes in to try to brush it, they're like, "Ooh, I can't get in there." Well, let's release the tie so we can save those teeth, baby teeth or adult teeth. The other reason I would do it is if a chiro or osteos, like Mandeep, there is a lot of tension in this plane. It's creating a lot of cranial tension. Again, this is not my realm. I can diagnose the tie. There are different grades, and they're being referred by a chiropractor who's like, I'm really trying to change the cranium. And again, we can make the argument. Some people feel like the sutures are 100% like formed and there's no movement. But chiro and osteos that are cranial sacral therapists, they understand there's movements happening all the time. Kids, I'm literally seeing heads change when we look at lip ties and buccal ties. Like I've had parents, I've had an osteo in the room do what's called a guided release, meaning I have a baby on the table who's getting a lip tie release and a tongue tie release, and have an osteopath who's literally holding the baby's head. And they can feel every change that I do intraorally. They're like, wow, we're feeling movement happening everywhere, Mandy. To me, that's mind-blowing. To me, that's like, it's learning for me too, so I know just the right amount and how much to release. So that's when I know I need to release a lip tie or not. And how do you put that in research? How do osteopaths and chiros release research on like this movement they're feeling in their hands? I think it's magic.
A lot of that is intuitive and almost, I mean, medicine is an art, I believe, versus just a pure science. I think there's an element of an art to it, and that's just some of the uniqueness of your skill and the practitioners you were working with.
Yeah, I mean, they could tell when your temporal bones are off. So when I look at babies, I'm looking at, are their ears lined up? Are their eyes lined up? And I know we're not a society about superficial, well, in Canada, not California, but like it's not superficial, right? So we're not like, oh, like they're asymmetrical, but that asymmetry leads to like the TMJ issues later on. That's completely off. Eyes that aren't level. Think about postural issues. It's going to have a detrimental effect. So if we can change that and we change our mindset in medicine, like, hey, listen, these osteos and chiros or any manual therapist, cranial sacral therapist, if they could feel that the sphenoid bone, the temporal bone aren't where they should be, and they can manually just do this little touch, why are we not doing this more? It would save us hundreds of dollars later on, thousands of dollars later on, if we can get manual therapists doing intervening at an earlier stage.
Yeah, no, absolutely. So I have a couple more questions for you. One may seem a little kind of over to the left, but it's about the teeth. and the teeth touching, where I have heard from a craniosacral therapist, and again, don't know if I'm interpreting this the right way, that when our teeth touch, and perhaps it's the clenching or just the touching action of the teeth, that is dysregulating to the autonomic nervous system. And it is something that can keep pushing you in towards a fight or flight sympathetic state. Is there validity behind that, or am I just kind of adding a little bit deeper interpretation to that?
No, you're 100% right. So our teeth should not touch more than 10 minutes a day.
Okay.
So patients that are clenching, meaning holding their teeth together, or grinding their teeth, their teeth are definitely touching more than 10 minutes a day.
Okay.
So it all comes down to anatomy. What nerve gets activated when your teeth touch is a trigeminal nerve.
Okay.
And trigeminal nerve brings us into like a very fight or flight sympathetic state, because you know why? The nerve, if you were to look at anatomy and trace the trigeminal nerve, you know what runs right along is the vagus nerve. So this is the size of the trigeminal. This is the size of the tiny itty bitty little vagus nerve, which is so powerful in what it does. But the trigeminal is so powerful that it will overpower the vagus nerve and will really shift the autonomic system, your autonomic system, into a sympathetic state. I see it over and over again. When patients are in my chair and they're clenching, I sit down with them. I'm like, what's going on? Like, are you in something stressful happening? Of course. New job, sitting for long periods of hours, some stressful situations happening in their life. We carry it in our face. Right? So they're already in a very stressful situation, and they're doing all this chiropractic work and osteo work, and they're trying to change their posture, and we got to go back to the breathing. We got to get those teeth not to touch as much, to relax the jaw joint, and bring them back into a parasympathetic state, right? Your digestion's off, everything's off when it shifts. So yes, the teeth are very powerful. We have a direct connection to the brain. It's so powerful. So we can use it for good, or it could go the opposite way. So I can help patients with both. Sometimes I want that contact there if they've had a concussion. Because if they've had a concussion, the brain loves the feedback from the teeth. So I will want their teeth to touch in a certain way. And it brings them back to balance, because we go right to the cerebellum. Because I have direct access to the cerebellum when the teeth touch and the trigeminals are on.
Okay. That's a fascinating distinction and differentiation, because we had a guest from Mary from Mayo Munchie, which was all about chewing, which is the teeth touching, and then how that could be used in this second example that you gave with accessing the cerebellum. But for everyone who's listening, as you're sitting or standing here listening to the podcast, there should be this awareness that your teeth are kind of floating above each other. Is that correct?
Right.
Like a relaxed floating.
Right. Yeah.
Okay.
And when Mary talks about chewing, I love the Mayo Munchie as well. We're not having you chew for 2 hours, an hour per day. We just want that chewing because it helps with development of the face at a younger age, because kids don't clench, right? Or they don't really clench their teeth. They just have a softer diet.
Very self-aware here of my face. How I'm breathing, everything that's going on. Okay, so to kind of start to wrap this up, I love tangible takeaways. I love knowledge nuggets and pearls. So for the listeners, we spoke about the teeth not clenching or touching, unless you're trying to improve balance, or a cerebellum activation. Around the mouth breathing, spoke a little bit about mouth tape, some of the breathe right strips and things like that. But anything else, key takeaways, easy takeaways that we can start to incorporate for ourselves and for our children as it relates to optimizing airway health and breathing?
Yeah, I would say don't wait. I would always say assess your sleep. We had touched on this as well. There's apps you can use. Get in with an airway dentist to assess the family. Like, how are you guys sleeping? What can we do to help improve your quality of sleep? We touched on that as well. And be proactive and preventative as much as possible, because we can avoid braces. People get braces for aesthetic reasons. If we just get the jaws and the airways to do what they need to do, the posture and everything will just kind of fall into place. As a society, we are so focused on nutrition. Everybody wants to like eat right. Everybody wants to like detox. But what about oxygen? You breathing an airway, think about oxygen. We cannot just because you're breathing, you're like, oh wow, I'm breathing already. Why do I care about oxygen? It's not efficient. You get your car tuned more frequently than you do your own body. That blows my mind is that we put so much into our cars and then we're like, oh my God, I waited too long. I had to put so much more into my car to get it repaired. Your body's no different. You only got one. So we should be more preventative and put more into our bodies than we do in our own vehicles, really.
Yeah, I love that. So powerful, so eye-opening. I love this as a podiatrist. I love this. I love the connections. How can the listeners learn more about your work, what you're doing? I know you run the Heals Summit. And then if someone is interested in seeing you as a patient, how could they do that as well?
Yeah, so they can follow me on Instagram. My Instagram handle is Dr. Mandeep Johal. And I put lots of information on there. It's purely informational, and they can DM me, message me. My office information's on there as well. And yeah, I would love to help anybody or answer any questions they may have.
But you do see patients virtually?
I do see patients virtually as well, yeah.
Okay, good, wonderful. Well, thank you so much for your time. There was so many powerful nuggets, and I hope that the listeners gain some powerful insights and everyone's going to start breathing through their nose.
Thank you so much for having me, my friend. Thank you.
Of course. Thank you. Thank you again for tuning in to Root to Rise. And remember, always, this is powered by Naboso. You can learn more at naboso.com. See you on the next episode.